The NGO Forum South Sudan works with both national and international organizations diligently to be able to respond promptly and efficiently to the humanitarian needs of the people of South Sudan. With this year's theme of National NGOs for Stability, Resilience and Innovative Development, the NGO Forum selected a number of national NGOs that have programs that brings this theme to life. HealthLink South Sudan has been working effortlessly, especially in the areas of COVID-19 screening and nutrition.
HealthLink is a national NGO that was registered in 2013 with the main purpose of focusing on contributions towards reducing poverty, alleviating suffering, and enhancing human dignity in South Sudan. Our philosophy is based on the principles of enhancing human dignity and focusing on the most needy people at the grassroots. We target the hard-to-reach communities where it's so difficult for humanitarian services to get there. But because we are nationals, we are community-based, we embed ourselves with the communities that we serve.
HealthLink implement healthcare programs in South Sudan in 4 different states, in Central Equatoria, Eastern Equatoria, Jonglei, and Upper Nile. And so we started very well. Towards the end of January, there were already information circulating about COVID-19. We support over 140 healthcare facilities. And at the beginning, we started receiving calls to coming from the health facilities, inquiring what are we going to do? Are we going to close healthcare facilities? Because the threat that are coming was a bit huge and everyone felt scared.
At the beginning of the year for us, it was business as usual, continuing with the service delivery, trying to reach more people. But of course, now with the developments around the beginning of the year with COVID, yes, we had to change our approach of doing things because most of the activities that require gathering of people in one place, we couldn't undertake those. We had to redesign the service delivery. We were also dealing with locusts. And that was a very big threat because of food security for us, where we look at nutrition of children and women and all the citizens in this country. So that was a scare we had at the beginning.
As you can see, right now we are here in Al Sabah Children's Hospital. Every individual entering the facility washes the hand there. As you can see, there's a hand washing station placed right there. They wash their hands there. After washing hands, they go to the screening point, as you can see right up there. At the screening point, they do temperature check of every individual coming into the facility. And the team there do registration as well. After checking the temperature, they have a tally sheet where they tally every individual who has undergone a screening or temperature check.
HealthLink being a principal service provider in Juba, we also push towards preparing for any eventualities that may come from Ebola to COVID. Our focus was, of course, everyone knows that the best methods of preventing the spread of COVID-19 is to keep away from the crowds around, do proper hand hygiene, wearing masks, and providing certain basic services at health facilities.
Given the occurrence of COVID, we realized that malnutrition not only occurs before birth, it's something that occurs either before birth, during, or due to other risk factors. Among the risk factors are pandemics and crises. Now, COVID-19 comes to South Sudan, an area post-conflict, which poses a high risk of malnutrition due to the limitation in the food stores. The food stores are empty, And also, given the occurrence of COVID, the most affected persons are the mothers and the children under 5. That puts them at a risk of malnutrition. Now, during this occurrence of COVID, we have received a lot of cases, and these cases are severe.
When a mother comes, we take the weight, we take the height when needed or the length, then we take the mark. The mark is an indicator which will show us where the child is relying, either for admission at the AC or not. So with this child, we have already taken the weight. The child is 7 months. We have already taken the length because we are laying the child down. The mark is 7.4 and it is very, very less. So we admit in this ward and we start with F75 initial phase to hourly. And at the same time, we start giving them drugs. We'll start giving them drugs, systematic drugs, the drugs that they are supposed to take compulsory because of the infection. There are infections that you see and there are infections that you don't see. So we all go through the systematic treatment.
Ligona jade fi musaida tangu edile ben lejena. Yo malana jibo fogo do taban. Lakini na genini tagara tajana bada gero. Ajata alta bodi leben madawayat. Ana mini jaini ana mabiyu dawa. Musesfa saba gisa idonas. Dawa majani leben majani. Mahalata ninde tabibiyu dawa. Be gurus ketir. Masakin mabiligo dawa. Ya umon bija fi musesfa saba.
Al-Sabah has been a big focus for us, children, and of course the health workers who are operating from there.
If you can look around, we have the drugs here. These are the drugs we have. They are supported by WHO and HealthLink. You see the files, these are the files for the children. We put them here in rehabilitation room. This one came from Gorom, but she was referred. She was referred from there. The child was not well, the mother decided to go home. And again, she came back with the child in this situation.
The challenge we have faced majorly is the late reporting. They report when they are critically ill, meaning they take longer in the program. And also it means the cost of getting them back to stable gets higher than what would have costed us in terms of medicines, in terms of nutrition supplies, to stabilize a child that had reported early to seek the services. Another challenge that we have faced as the stabilization center, we have had a high increase of cases that stay longer. The bed capacities are, we have a 34-bed capacity, but the cases are higher than 34, meaning we have a high number of caseloads, more than what we can handle, especially during this COVID, given that they stay longer and there are more cases that are reporting. They report late and stay longer on program.
But on the first day, they don't accept admission because they think they're coming to stay with us longer. We are coming to waste their time. And at the same time, they don't know that their children are malnourished and sick. But after explanation with health education, we have social workers who are paid by HealthLink. Now they come to understand. And more of them also come. When they come visit others, so they bring other children.
As a national NGO, our focus has always been feeling the pain the community goes through and being part of it, being part of the solutions to the challenges, the issues that the community is facing. And because of that, we have always embedded ourselves, and we have seen a lot of progress through the work we do at community level, at county level, at the state level, at the national level. And for that, we are glad to the donors, DFID, USAID, EU, Sweden, Gavi, that have always stayed with the people of South Sudan.
HealthLink is committed to contribute to the prevention of malnutrition in South Sudan. The generation that we are treating today, the children under 5, are the future generation of South Sudan.
NGO Forum specifically has been very crucial in terms of mobilizing for the resources, in terms of IEC materials, especially on COVID-related matter. And then they share with the partners, and the partners make use of these materials and distribute down to the health facilities, for example, and also use the same materials to reach out to the communities in the respective counties.
HealthLink as a national NGO is part of the NGO Forum. We benefit a lot from the National NGO Forum and from the NGO Forum as a whole. Being in the forum strengthens our negotiation capacities, helps us to access funding, and also we receive information on various things that goes around the country.
When it comes to innovation, Hold the Child has had some very creative ways to pass on the message and raise resources during this pandemic. Let's hear more.
With the trend and with the need on ground, we needed to adopt different ways of doing things, innovative ways of delivering services to the community, to our children that we hold dear, and to the nation of South Sudan. Among the programs that we do that are innovative, that bring out the innovativeness that we needed to bring is the Kids Express. Kids Express is a program that we do in partnership with Radio Miraya 101 FM that looks at reaching out the children in the community. All right, let's go home, prepare, and I will see all of you on Saturday at exactly 12 to 1, okay?
Hey, again, we talking bedugu. Kev, bedugum. Dear listeners, welcome to Kids Express, a show on Radio Miraya 101 FM in partnership with Hold the Child.
This program was birthed during the wake of 2016 crisis, where everyone was running up and down, and we were just sitting at Sherikat where everyone was piled up there. And the children were also frightened, but nobody would care about how the children would feel. So we ran a program to schools called Solidarity for Hope campaign, and it was successful. So we had a chat with Radio Miraya, Unmis Radio in South Sudan, and they were like, okay, you guys can do a program that can bring children to the studio, they are out their views, and then you can work on different topics. And it has been very successful of late.
So our partnership with Hold the Child, it has started since I think 2000. It is like 3 years now. So they are coming to do some of the programs with our learners, taking them to Miraya FM to participate, doing debate. Like even it has encouraged some of the teachers to give more programs to the learners.
When I was on the radio station, my parents was very happy with me, and my neighbor and my friends too. Even my friends told me to want to join the school. That time to join the Express Kids.
Basically what we do is we go to schools, and now in the schools we get to prepare children for different talking points, and these talking points are not limited. We talk about almost everything that affects children, not limited to child marriage, not limited to education, not limited to health, not limited to peace, not limited to democracy. So these children get to air out their views. Our work is only to make them express themselves. Kids express from the word expression, so kids expression. This program gave birth to school peace programs that were sponsored by RJMEC, and they were working together with Citizen VM. This program, we looked at how we can reach schools with putting together the hard terms used in the peace agreement or the agreement of the resolution of conflict in South Sudan. That agreement was very complicated, so we had to break them down. So we did a lot of workshops within Juba and WOW, of which was fully sponsored by RJMEC.
So I think as the head teacher of the school, I'm giving thanks to them because they have support us with a lot of things, like child early marriage, special for girls. So that is some of the ways they are trying to teach girls to stop so that they cannot go for early marriage. So I'm giving thanks to them. I think they have to continue with this spirit so that at least we encourage those girls to be all educated.
I felt very happy to listen to Kids Express on Radio Miraya because these are my kids from my school. So they educate our people, they educate our learners. So I felt very happy when I heard from them. What they said for sure has helped our learners and our community and all the nation.
On education, we talk about health issues, we talk about our society, we talk about how we can make our country better. So this program has reached very many people. We have posts on Audio Boom. We also have posts on the pages for All the Child and Radio Miraya. So the impact has been immense. We've gotten fundings through this very good program. We've also gotten like a lot of connections to different people, and the program has reached out to very many children. We've reached out to most schools in Juba, and the program is reaching out to, because of the coverage of Radio Miraya, the program has reached the entire South Sudan. We've had feedbacks deep from Rumbek, from Torit, from all these other places. One other girl was from Menta Nursery and Primary School, where she told us that the dad called her all the way from Bor and said, "I heard you on radio," and I was so proud. So some of those feedbacks make us feel good. We've had feedbacks from the ministry, we've had feedbacks from Radio Miraya themselves. That's why they've kept us on the program.
So when it comes to innovativeness in terms of provision of emergency health, we realized it was very prudent to involve the fathers, encourage their wives or the expecting mothers to come and carry out their antenatal visits. And this means we look at the mother, encouraging her to have facility delivery and discouraging her to have deliveries from home, which we call the traditional birth attendants. So we realized we were able to register 98 skilled deliveries in the facility, which was a remarkable job, because in the beginning, all the expecting mothers were attending their services in the community, which was not recommendable for an expecting mother due to complications and other issues. Also, in terms of innovativeness, I would like to point it out that we have involved the fathers in preventing malnutrition. In the beginning, we used to have the mother-to-mother support groups, but we realized that to prevent malnutrition, it's a contribution and a role of everybody in the family. So at this point, we have father-to-father support groups, which normally sit to give key messages on prevention of malnutrition, because the approach in this country, or the approach we are shifting to, is to prevent than treating. We realize a lot has been invested in treatment, but now we need to shift to prevention of malnutrition in South Sudan.
Other innovative ideas that we have worked out as Hold a Child is Darts of Hope. Basically, Darts of Hope is a program that looks at highlighting the way you see darts, some of the shooting stars in South Sudan, some of those outstanding things that are in South Sudan and no one is trying to pick up. For example, we did a documentary in Bor of a young boy called Michael who emerged the best in the first PLE joint exam, and we did a documentary on him. And we look forward to highlight some of those important pieces that are in South Sudan, and also sell the good news that is happening in South Sudan. This program is intended to run every year, so we'll be doing at least a documentary every year highlighting very important issues in South Sudan. Besides the normal ways of fundraising, which is sourcing for fundings from CHF, the UN communities and other partners, we also decided to derive means of fundraising from different angles. We put together an annual partners breakfast. We put it first in 2020, and we want to make sure we put it every year. This is the time where we call partners together, and even prospect partners that we expect to, or we hope they can support us, and we call them together, and then we dine together. We get some snacks and we eat, and we talk about our programming and how it is very important and how everyone should jump on board. Hold a Child is also a member of the South Sudan NGO Forum, and we benefit through their different modes of information sharing. We've benefited. They keep giving us all the information that is needed on fundings. They give information on jobs, and we also give, as we are looking for staffs, we get to post them on NGO Forum. And this has been so instrumental in our activities and also in our program.
With protection as a key issue, this year, Lulu Care has been working with women and girls to ensure they are safe and productive during these times of COVID-19.
Lulu Care is a women-led organization. It was established in 2016 and registered in 2017. We operate in different states. Warab State, that is in Toin South, we do child protection, women economic empowerment, and in Central Equatoria, we do child protection, we do WASH, women economic empowerment activities at the Women's Center. And in Eastern Equatoria, we do child protection and as well as education. With the escalating issues of gender-based violence due to the COVID-19, the Ministry of Gender, Child and Social Welfare mandated Lulu Care to do the call center, which we had already because of our Big Sister program in Capoeira. And so with the help of the Ministry of Gender, we started the call center, to which now we respond to gender-based violence issues and the child protection issues as well. The toll-free helpline was launched on 21st of May 2020 in the presence of the Minister of Humanitarian Affairs, NGO Forum, Minister of Gender, Child and Social Welfare, and other stakeholders. Lulu Care is committed in making sure that the call center is still ongoing, no matter, in as much as we are trying to live with the COVID-19. We are getting the calls for gender-based violence, child protection, and other issues.
As a government officials, as humanitarians, we have condemned gender-based violence in all sorts. And I wanted to repeat here that my government does not encourage neither tolerate any gender-based violence.
I appreciate this initiative. It's my prayers that it works here and it works beyond what we are doing. And everybody involved gets help. I want to congratulate you again, and I must tell you I'm very proud of you. I'm very proud to be part of you. And today I can walk with my head up. I know there's so much happening. Please, let's work.
Having this in place is something that is going to take us a step further, realizing that these are the resources or people who are supposed to be protected in South Sudan. So from our perspective of the NGO Forum, we are proud to be part of this initiative, and we'll be able to actually encourage Lulu Care and with other NGOs, especially working in the GBV section.
It has a protocol which is placed down. At first, we always see the caller's concern coming in. The caller's concern will be raised in different perspectives owing to the challenges that are brought in different perspectives, as we mentioned earlier, being either physical, sexual harassment, economic issues, or even we have gone beyond to even getting callers from the COVID-19 information requirement.
Lulu Care is committed in making sure that the call center is still ongoing, no matter, in as much as we are trying to live with the COVID-19. We are getting the calls for gender-based violence, child protection, and other issues. Like for the flooding, people want to get assistance for food items and medical items.
As you see, the phones are placed in different tables, and therefore triaging is very easy. If one is handling one case, then it will always be extended to the other person or the other social worker. For this case, the social worker will handle this case individually and record every information into the system, either manually or into the system using our computers, as you see on the table. Talking about our response officers, as you see them, through the challenges of language barrier, we have taken them from different parts of the country. There are those who are speaking 2 or 3 languages. There are those who are speaking up to 5 national languages. And for this case, it is easy for one to get to know what the concern is when it comes to the challenge of language barrier. They are social workers. Most of them, they have studied through the social workers, and they have undergone trainings that includes prevention of sexual exploitation and abuse. They have gone through communication skills. They have gone through the GBV IMS, and of recent, the CPIMS. So for this, they are good to also handle these cases in different perspectives as they come into the call center.
في البداية أنا بشتغل بقانون المتحرك بيشيلوا فهمته كتير ياس أنا راح في training تلولو كيا ألمانا عشان أنا بشتغل سالة القانون ده زمان ده اللي أنا جراه بقانون ده جا نسلولو كيا ألمانا كوروجو عشان كيف أنا بكوروجو قريب بيت تنا يالتاني منالي منا أنا بكوروجو في جاسوال sen ma bishilu mo ketir kumo suya sen bi raba sere
sual da ita be gido kasamu kilikun ma hawa suya yala yani sabab alge jaraje de zere walge kutu torab de fi sual zere de asan hajata kilta jara enak de ita bagdir bahawi
yala jara to ita ma bijara ukulu ita bijara nus asan kanu mon geraba mon biligo space ta mon commander hawa
yala selan nazar hajat sual yakutu anna bega sunu rakam anna gata mula asere tan gera kabu yala tan de rande tebi asere anna bega kwesin be yalta na fi bet.
We thought it was best to have these kitchen gardens within the communities. So far we have had and trained a number of women, and it is much successful. We have seen the fruits even back at home. We have seen many women have really bought the ideas, the knowledge and the skills, and they have really replicated the same in the communities. We urge and also endeavor to, we also ask, of course, and request other partners to join the same program into the activities. And we will always commit ourselves to empowering women in this, in the whole parts of the locations where we are implementing our programs.
Lulu Care operates under the National Action Plans and the Global Sustainable Development Goals 2030. We excel to be the future of women's strength. To end your forum, thank you very much for the support that you've been giving us in terms of communication and information sharing. During this difficult time, you've stood with us, and also when we launched our 662 line, and your forum was the first one to come here. We say thank you very much for the work that you've been doing, linking us with the different donor community and also other national NGOs that have partnered with us. It's because of NGO Forum.
Next, we went to the ground to see how Nile Sustainable Development Organization, NSDO, has been responding to COVID-19 challenges, especially in POC camps around Juba.
NSDO, Nile Sustainable Development Organization, was formed and registered in 2016 with objectives to support and to render services to the needy people of this country.
We implement majorly WASH, that is water sanitation and hygiene activities. And we also have other activities like education and food security and disaster response. And as I talk, we have a full capacity on water sanitation and hygiene activities.
When the COVID came in March, it caught everybody by surprise, and even including our organization. We do not know that the COVID is going to happen. But then, when COVID happened, and it was announced by the Minister of Health, then we have to sit down again and review our objectives and also what we have planned for 2020.
The knowledge, the message of the COVID-19 prevention has gone to the communities. People are aware, they know how to protect themselves, they know the practices to have in place, they know the do's and they know the don'ts.
When you hold like this, then you make sure you put exactly, it covers the mouth and the nose, not down the cheek. Okay? This is your cheek down there. Okay? So you put like this. Cover. And then you hang it on your ear. Okay? You hang it.
I'm happy so that the school will open. And there are some organizations like Nile Sustainable Development Organization who are supporting us, giving us masks, soaps, and very many others in order to control COVID-19 or prevent COVID-19.
Yala zaman kan news ta coronavirus ja wasulu diga jakara baya haja. Yal tanin sibu madarasa bigen fi jahila. Haya biga makwes. Nas ketir tigeni tabanin min kalam ta coronavirus. Yala si dana bigen fi jakemi ndana moksutina chanana rija fuko madarasa one NGOs and then the other organization almon beside anna individual camp bijibul anna sabun bijibul anna moya anna moksutur momon kwes yala mon jibul anna mas asan kef anna bitu madarasa tanna legedam.
And the water is clean, it is treated at the Nile. And then when the water arrives in the POC, we have a water quality monitoring team that check the water.
This is the entering gate. Whenever the truck comes, we check the water by full tester. About 34,000 people, they are on my hand, their hand. When the water is dirty, they will get sick, which is not good.
It is very important to have this thing, to have this both sides. Having a water to distribute it to the latrine, which is a side of sanitation. We're having a garbage collection, and we have a truck for collect the waste to all this waste in POC, both POC, POC 1 and POC 3, and we have a dislodging truck to dislodge all the latrine in both POC even.
We have already installed 53 hand facility in all the public places inside POC 1 and POC 3. So we are targeting the market, the public places, the hospital and the schools. So this water, in part of water, we supply it. And then there are more facility that we have distributed, like buckets, to facilitate. The bucket is at the household level to facilitate the hand washing at the household level. And also we give them soap. Each household in POC 3 have to receive 3 bars of soap for a period of 3 months.
So far, the COVID journey actually for NSDO has been a bit tough. It has been tough, but it was also interesting, simply because, for example, we have all the hand washing facilities in all the public places. We have hand washing facilities in police places, prison, and the courts and other many marketplaces. But then what happened was that, you know, it's damaged, sometimes the taps are stolen. It becomes a bit of challenge for us. Although you keep on telling people or sensitizing people, informing people that please, you need to wash your hands. Sometimes our hygiene promoters get challenges because the response was a bit tough.
Sanitation has a lot of challenges in the POC because the population is huge and the site is a little bit small. There is daily garbage collection. Collect the garbages, take them outside the POC, dump them at the city council dumping site.
Tasin ano yang yetalo du ngana banga cover corona wawo musave ka MC bika changa na gwata de yang gwa fini beje ya mo ka sabun cha mo ka piudu la kana ka bai mo ka mas mata kana musul me jena no musul fini bai mo ka mas bai jola tar amma tasin lar ka yako
nana padrani na le manadama gati haganti bijibu dawa bijibu moya bijibu akil nana padranin ana padran isima rabbe ganyanduong isima padran ana padran.
Yes, and then the other thing is you know, the COVID came, and then there's problem of funding. There's no money, there's no donation, and we have been relying much on donation. But previously, we also planned to do some income generating activities within the organization. For example, doing wash consultancy for other organizations and even the government. And we have a very good rig. We have wash team drilling boreholes. And we started drilling for private companies and even for other organizations. And we have been generating money that we have put in to support the COVID-19 activities, which is very good. Much of the money has gone for training of youths in the POC.
NSDO has been partnering with NGO Forum since 2017, and they are doing tremendous job. They are doing an excellent work. Without NGO Forum, I don't think that the NGOs in South Sudan will deliver what they are doing today. NGO Forum has been fantastic, with very professional way of negotiation with the government. They also participate in sometimes legislation, laws, NGO Act. They play very big role. They also organize a very big NGO recruitment workshop here in South Sudan to discuss the labor law and to agree with the government together to form a section for NGO recruitment guidelines.
For me, someone who works in program, you know, I am still getting a lot of capacity building from NGO Forum. They have a program which is affiliated to the Humanitarian Leadership Academy. It is in Europe and it is online. There are so many courses about humanitarian responses that are online. It's for free and we are doing it. Most of our staff are doing that course.
TT Foundation has been having programs dealing with resilience for years, but this year they had to customize them to respond to the COVID-19 pandemic.
TT Foundation was founded on 14th November 2016, and it's purely a women-led organization which focuses on women and girls to be able to empower them in the sector, in political, economic and social aspects of life.
We have been able to reach more than or over 50,000 in videos with assistance in this resilience program, but still as humanitarian assistance is so much required. You know, people are really in their need because of many kinds of needs that are rising there and then.
So at the beginning of 2020, we had anticipated on various kind of resilience programming, especially under the food security and livelihood projects that we are running across the country, from Jonglei to Central Equatoria to Lake State. And unfortunately, along the way, we had to start, experiencing the pandemic, and South Sudan is not an exception to that. And as a result of that, we had to ensure that the much needed services to communities are delivered irrespective of the pandemic in place.
One of the programs that we have a program that is responding to COVID-19 in Juba. And we are capable to cover a total number of over 1,000 households that are affected by COVID-19. And we have the resilience program that is ongoing, of which we are entitled to give assistance to most of these affected individuals by COVID-19. And we are going to be giving cash food assistance, cash vouchers. We are going to be giving them hygiene kits assistance, of which the project is already ongoing, and families prove that they still need more assistance.
I'm talking to us in plural to change our behavior. To mitigate gender-based violence. You have seen how my colleague has taken you through the effects of COVID-19 on GBV. At the same time, still, that's the reason as to why we have come back to talk to you about food. Because not only the GBV part of it that it has affected, but it has also affected even effective people.
So we had to, bring on board now the new measures and take them in and be able to still continue with interventions, irrespective of the challenges that the pandemic is proving, in that, we cannot easily get to physically meet with beneficiaries or even our donors. But luckily for technology, there has been the issues around virtual meetings, which we're able to conduct and update our donors accordingly on the progress of the project, but at the same time be able to also to mainstream COVID-19 in the different programs that we are carrying out throughout the country.
Part of the challenges that we have been receiving, one, the community expects a lot, and there is limited funding, of which whenever they see that an organization has come in, they expect that the organization has brought everything they need that will cover all. And yet all these organizations have targets and of vulnerable communities that they are targeting. So at the end of it all, we find others having a conflict of interest, especially in the chiefs and all other people that are stakeholders that we're working together with, because they always assume that they can be able to help theirs first before we can be able to help the vulnerable communities.
As TT Foundation, we are actually working closely with the NGO Forum. We happen to sit on the National NGOs Steering Committee, and I sit as the Deputy Chair for all national NGOs through the NGO Forum, and also representing them on the South Sudan Humanitarian Fund as part of the advisory board members. And the NGO Forum has been able to give us immense support as partners and members, in that when it comes down to issues around advocacy and better working relationships, especially in the humanitarian architecture, they have been able to quickly assist TT Foundation in specific, but also the rest of the other members. When it comes down to issues of security, they have been able to clearly assist TT Foundation in terms of telling us prior information on security incidences in different parts of the country. Well, TT Foundation would love to say that we are very committed to our mission of being able to reach out to the different categories of populations across South Sudan and beyond in delivering services, and we will continuously continue doing that with the support of our dedicated staffs. But at the same time, irrespective of the challenges that the pandemic brings on board, we are willing to maneuver through that process and ensure that services are delivered at the right time to the right populations.
Humanitarian and Development Consortium, HDC, has been at the forefront in transforming the lives of young people in Juba during this pandemic.
Humanitarian Development Consortium, HDC acronym, it's a national South Sudanese organization, and it was established in 2008. Now we are 12 years of existence. HDC, we have a vision as an organization. The founders, when they established, like every founder, you set a vision and a mission of the organization. So our vision was to have an empowered community living a dignified and a prosperous life, and having the capacity or possessing the capacity of participating in decisions that are taken for them. So our mission also was to support now these vulnerable communities affected by the crisis of South Sudan, to attain a dignified life, and through the community programs.
When it comes to the peace building programs, we have our focus on peace building is under the IDP response, and that peace building is divided into two. There's peace education, and then there's the real peace activities that we do.
As an organization, our programming focuses on how a refugee lives together with the host community, how an internally displaced person who left his home, he came, for example, to Juba, can live with the community of Juba. How a returning South Sudanese who has left the country for 6-7 years, he's returning back. How is he going to live, to coexist with the people he left, despite the crisis, despite all the challenges they faced? So that's how the peaceful coexistence and governance activities, so that the community understand what's happening, how the country is moving from the emergency to recovery and to development.
Under the peace education, we also have training on tailoring. There are quick impact projects that are there, and one of them is tailoring. We have hairdressing. We have motorbike repairs. So these individuals are mostly youth. Like the tailoring that is to be conducted in Don Bosco is focusing on women only. So we have 20% of the women should come from the host community and 80% from the IDPs. The total of them is 25, and that training is ongoing now. After it was disrupted by COVID-19, now it has resumed.
Today we are at Mozzarella Women Promotional Center, where HDC and its partner UNHCR is implementing QIP's Quick Impact Project on tailoring. The reason why we are implementing this Quick Impact Project in Don Bosco IDP camp is because we want to promote peaceful coexistence between the host community and the IDPs, and we also want to make the IDPs self-reliant and continue with their livelihoods as they did back home before they settled in their new settlements.
Makanada o quiz. Obisai na fi zaman time fi bet. Taban zurma iya san kan zol tanji bugu masto ga kana kaito. Ana be kaito ana balgo ko gurusu ya sana bag dera kil mayal tai. O dirsa ta madam tena de o tamam chedit. Kan tema bar kalam tabriya lo o borlita kaman. O balimita bera na manta sunta be faim kalam to de.
Feel we have made a progress, a good progress, because at the beginning there was that big challenge of introducing them and making them understand. So, but for now, where we are, I can say it is a great step we have made.
Chocolate beside ana badin kanana kari, beside nas beten zato, wana zato nas osrata zato bakul fogo. Beside ana mustaqbal tay badin.
So we are here for the community. So if the community is not safe, if they are not if they are sick, we will not have people to work with. So our first aim is to sensitize them how to protect themselves, to understand the COVID, the symptoms, and then currently we have 4 projects of supporting COVID-19 affected community. All the donors have accepted, they are so flexible, we are thanking them to us to adjust to ensure that we are including COVID-19 related activities, meaning we are supporting people affected so much by COVID in addition to the crisis, flooding, conflict, and then we are also sensitizing them.
Well, the impact has been actually huge, even when we're just starting with it. One, when we talk of the training, of course we are empowering the women who are always the breadwinners. So when you see this one happening, they are really happy. Even now in Don Bosco, once they are trained, they will be given tailors, tailoring machines, sewing machines, where they can be able to go and start up their businesses.
As you can see today, we are issuing out the cash. We had carried out a database registration of older people here in MAD. We have 400 beneficiaries of the project here in MAD. Of course, in other locations, we also have beneficiaries. We have 250 in Mangatene, we have 150 in Don Bosco, and then 200 in POC. In what we did out of this beneficiary, because the donation was small, it could not cater for everyone, we went and identified the most vulnerable persons. As you can see, it is raining, the beneficiaries are around, and the need for the money is high. We cannot stop. We are moving on, issuing out the money so that they can go on and then assist themselves, get those things I mentioned like medicine and some good food which are some ingredient to help their body.
Today we are at African Women Help Organization Motorbike Repair Workshop, where HDC and its partner UNHCR is implementing the QIPs from POC1 and POC3 on provision of vocational education for the IDP youth.
We South Sudanese youth, we have been sitting idles without getting knowledge like this one now. And this one, it has given us a bad impact on us because they don't have anything to do. But with this thing, it has moved us from those groups, from those bad things. Now we are thinking, like me now, I'm thinking if I will do this and I will have the knowledge, now I will be willing to share the knowledge with those who doesn't know. I can set up a wholesaler if I get a capital, then I can be dealing with the motor repair and parts. So that's my planning now. So I will not be planning or thinking about those bad things now. So I will be thinking about my future.
We as HDC, we believe once they acquire these skills and go out there, they'll venture into the work markets and better their lives, and they'll bring positivity and changes to their communities.
Let me say HDC has done something good to us. Not HDC alone, the NGOs in South Sudan who are trying to help South Sudanese. So most of them, they are working very hard in order to get the South Sudanese in a level where they can be independent for themselves. Someone can be given a knowledge, and that knowledge will drive someone somewhere where he can be able to cater for his family or her family. So I really appreciate HDC for this initiative. It is a good initiative for all South Sudanese. The knowledge that we get, I think it will drive us somewhere. It will take us to another level.
NGO Forum has actually been the supporter of especially national NGOs. Of course, national NGOs are always doing a lot of activities and not known out there. So for them to be able to communicate what we do is really wonderful.
Since 2014, ADC started being a member of the South Sudan NGO Forum. And we are an active member. We participate in the assembly meetings, we participate in national directors meetings. We are part of many technical working groups, security and safety, communications, human resources. And we ensure that our staff understand the role of the NGO Forum in the field and here in Juba. NGO Forum plays a big role to ensure that national organizations, we grow up and then we reach a level of competing, because here, for us to be able to get funded to support our community, you have to compete for fund with other international organizations. So NGO Forum always advises us, and they ensure that our capacity is built to the level that we are able to compete and then to comply with the donors' requirements for us to get funding and to support the community. ADC supports you in this year theme of national NGOs for resilience, stability and innovative development.
NSDO supports you in this year's theme, National NGOs for Resilience, Stability and Innovative Development.
Hold the Child supports you in this year's theme, National NGOs for Resilience, Stability and Innovative Development.
Digi Foundation supports you in this Expo theme, National NGOs for Stability, Resilience and Innovative Development.
Health League joins you in this year's National NGO Expo under the theme National NGOs for Resilience, Stability and Innovative Development.
Lulucare is glad to join you during this 5th annual Expo on National NGOs for Resilience, Stability and Innovative Development.